Hello everybody, I'm going to try recording right onto YouTube and see if that works better. I had made a video earlier today and tried to upload it a few times and it didn't work so well. This is Dawn again, my second video in my video blog about my upcoming spinal fusion surgery for spondylolisthesis. A little while ago I got a call, well actually about a week and a half ago, that my surgery date had been rescheduled. From my first video, I told you that my surgery is going to be July 18th. It has now been delayed till July 26th. So today is July 16th, and I was expecting I'd be having my surgery in a couple of days, but it won't be until the 26th. The surgeon was kind enough to tell me why. He has another patient that's been in the hospital for 4 months and has had to have his surgery rescheduled twice because of his medical status, and the only date that would work, he's more stable now, and the only date that would work for my surgeon and the other surgeon that was required for this surgery is the 18th. So mine got delayed. I tried wearing glasses today to see if it would cover up my bags a little bit more, but I see from looking at my webcam that I look just as tired today as I did on the other video. So a little bit more about me. I'm 45 years old. I'm 6'1", very, very tall. And I played a variety of sports through the years in high school and college. I was even involved in dance quite a bit. I know 6'1", that doesn't seem right, but I was in high school, college, dance camps, and I'm currently even doing choreography for the local high school music and drama club. I was also in the Army, and now I'm a physical therapist. So over the past 4 to 5 years, the way that I've dealt with my back pain, of course, has been with physical therapy, strengthening exercises, trying to stay in shape, different modalities. I've tried TENS units and shortwave diathermy, which is a deep heat to the back. And over the past year, these things have just been not working, and my activity level has decreased, and I've gained 20 pounds. All of these are very, very hard on me. So, again, with the symptoms that I described to you last time, with the lightning bolt taser thing, that is why I've taken the step towards having surgery. I thought what I would do today is share a little bit of information. I got a booklet from my surgeon. I don't know if I can see here. It's called Spine Surgery. And I'm just going to summarize some of the things in here that, in case you didn't get a book like this, it starts out with a little anatomy. Can you see that? This way. The spine, different parts of the spine, talks about the disc and the vertebrae, different parts of that. Kind of a nice outline of that. And it starts out preparing, the first topic is preparing for surgery. And in this page, it talks about how long to plan to stay in the hospital after surgery. And for most patients having a spinal decompression, so that's without a fusion, that would be something like a laminectomy, you'll probably stay 1 or 2 nights. Patients with a spinal fusion could stay 3 to 5 nights. And patients that are having a multi-stage procedure typically go home 4 to 5 nights after the last stage is completed. So some folks have both the posterior fusion and then anterior fusion, and sometimes they do it all in one day, sometimes they're unable to do that. I know for myself it's going to be a TLIF, transverse lateral intervertebral fusion, I think is what it stands for, and that's just a posterior approach. So I should be more in the 3 to 4 night range. Obviously you need to, temporary decrease in your activity. Well, my activity's been decreased a lot already, and I know that it's going to be more so after surgery. Some people go home after surgery, and older folks sometimes will go to a skilled nursing facility for a few days to weeks until they're ready to be at home on their own. Things that you'll need help with, to have someone to help you with, they call it caregivers. You'll have someone to help you look at your incision and change dressings, help you take your brace off, get up and out of chairs and up and off the toilet, get in and out of bed. Obviously helping with meals and dressing and driving. This is an interesting little thing. If you are treated in a brace after surgery, you usually will not be allowed to drive during that time. Yikes. From the information I've received, I'm probably going to be in a brace from 6 to 9 weeks after my surgery. Luckily, I have a 16-year-old son, well, he'll be 16 on Wednesday, who will be more than happy to be my chauffeur and run errands for me. So I'm lucky to have that. Here's something that I didn't realize in the reading and preparing that I did for surgery. It says in here that you should not be alone for more than 3 to 4 hours at a time during the first 1 or 2 weeks at home. So I guess that's because if you try to get up or fall or something like that, that wasn't something I had expected. They talk about in here making sure to speak with your surgical team about specific restrictions that will be in effect after your surgery, and how to get in contact with a skilled nursing facility. Again, at 45, I'm not worried about that, but older folks, they say you can contact your hospital's social worker, or you can go to medicare.gov. So again, medicare.gov, you can help find a local skilled care facility for those that can't go right home from the hospital. Preparing for surgery, plan to leave your home clean and orderly, so cleaning will not be necessary during your surgery. I've not been able to do much house cleaning, and my teenagers are getting a little tired, I think. They miss their mom/maid, so I kind of highlighted that we need to have the house orderly, and they need to have all their shoes out of the way from the back door so I don't trip on them when I get home. They also talk about removing throw rugs. So some other preparation is several weeks before surgery, do not use tobacco products for 2 months before surgery. I don't smoke, but obviously if you do, try to quit. And even if you can just quit for 2 months, that will help. Review your list of prescribed medications with your physician to determine if any of the medications you are taking could increase the risk of bleeding during surgery. So I'm not on any blood thinners or anything, but if you are, you need to discuss that with your physician. 2 weeks before surgery, stop taking all non-prescription medications, including any herbal supplements that could cause increased bleeding. So this is ibuprofen, Advil, naproxen, Aleve, these kind of things. You can take Tylenol for pain management. Yippee! My surgeon has also encouraged me not to take any Vicodin, oxycodone, Oxycontin, that kind of thing. I hadn't been taking a lot of it. I'd really tried not to, but I had been using it intermittently, and he said that if you can take a break from it for 2 weeks before your surgery, that you'll have better pain control after your surgery. So I get to take Tylenol. Whoopee! If you have any illness or any symptoms change before surgery, call your surgeon. 1 week before your surgery, you will need to have your pre-op exam. So I've already had all that. And before I saw my surgeon, I had an MRI and an X-ray. And then the first visit, he wanted to try injections to see if that might provide any relief. So I had a set of injections, and I got some temporary relief, maybe about a week, a day of relief. Then, we met with again and decided to go ahead with the surgery. And so then I've had a CT scan, I've had blood work, I've had a urinalysis, I've had an ECG on my heart, I've had a bone density test, and he even did a nasal swab. I guess he's wanting to make sure to rule out any possible infections. And so I've done all that. You also want to meet and talk about goals and risks of surgery, discuss further questions, that kind of stuff. Now here, where I'm going to have mine, they will give me 2 packages of Hibiclens, which is an antibacterial soap, to shower with the night before and the morning of your surgery. Bathing helps decrease bacteria on the skin and may reduce the risk of infection after surgery. So that's something I didn't know. And then they'll want you to get that brace before the surgery. Here's an interesting list too, is what to bring to the hospital. You want to bring a list of prescription medications, over-the-counter medications, and vitamins you take, including the dose and time you take them. If you use a CPAP for snoring and obstructive stuff for sleeping, you want to take that along. I don't have one of those, I don't have to worry about that. Comfortable, non-skid walking or athletic shoes. A cane walker or other assistive devices if you own them. Soft, loose-fitting clothes. Personal items such as books, magazines, and a cell phone. Money or a credit card to pay for take-home medications. And for gentlemen, if you are interested, an electric razor. So the evening before the surgery, here At my hospital, you need to call ahead of time to see exactly what time in the following morning you need to report, and then obviously stop eating after a certain amount of time. I think it's usually 7 o'clock, and take that first HIPAA shower. The day of the surgery, get up and take that second HIPAA shower. Report to the hospital most likely very early in the morning, and you'll meet with the anesthesiologist, and your family will be shown where they can wait and notified when you get out of surgery. So after surgery, when you're still in the hospital, you'll be brought to your room. They say do not try to get up without help unless your surgeon, nurse, or physical therapist instructs you otherwise. Here's an interesting thing that I didn't realize either, is that it's not unusual for patients to spend their first night in the intensive care unit or ICU. So wow, I hadn't thought about that, that there's a possibility that you might spend a night in the ICU. Again, mentioning you have to wear the brace if you've had a fusion, and patients are expected to be walking the day of or the day after surgery. Unless your injury prevents you from doing so, walking is required and encouraged. Your nurse or physical therapist will help you while in the hospital. And they talk about pain control next. Given medications, they'll have that little pump thing. If you're having any nausea or other symptoms, let your nurse know. And then before you can be dismissed from the hospital, you have to be able to eat and drink. You have to be able to use the bathroom, be able to walk around, transfer safely, like from the bed to a chair, walk up and down stairs, be able to control your pain or have your pain controlled with the medications, and free of drainage around the wound and showing signs of healing. So there's more information about what to do after you get home, but I think that's enough for today, and I'll try to get this posted. Thank you.